Hi, I am Susan Ellenberg, and welcome to my second episode of In Just One More Thing, where I take the opportunity to share a few additional thoughts on topics that you may have heard me talk about elsewhere. I said in my first introduction that we were going to look at work across this massive county with its 50 plus departments and 22,000 employees. And today we're going to focus on the county's public health department. The County of Santa Clara's public health department's mission is to protect and improve the health and well-being of our community. They work to prevent disease and injury, promote healthy lifestyles, create healthy environments, use data to inform decision-making, and advocate for policy and system changes that advance racial and health equity. This is a pretty big department. They have 765 employees. The budget is about $220 million, and they get funding for very specific programs. Some of the programs include addressing communicable diseases such as sexually transmitted infections and HIV and influenza and of course COVID. They look at population health data such as children's health or health by ethnic groups. There are specific programs for specific populations, for example, Black infant health and our Perinatal Equity Initiative, which I'm going to talk about more in a little bit. And they do injury and violence prevention, including suicide prevention, looking at reducing youth harmful behavior, whether it's around smoking or vaping or drug use. The director of the Public Health Department is Dr. Sarah Cody, and probably before the pandemic you had not heard of Dr. Cody, but she is pretty famous now. And Dr. Cody has two specific and separate roles. She is the director of the Public Health Department for the county. Therefore, she works for the county and falls in the order of executives under our county executive, James Williams. She also has a second role as the public health officer for Santa Clara County, and that authority comes from the state, from the California Department of Public Health. So during the pandemic, a lot of the authority that Dr. Cody exhibited around testing and isolations and vaccinations came from her role at the state. So that's a quick overview of the Public Health Department, and we'll be back in a minute to talk a little bit more in detail about Black infant health and perinatal equity. Welcome back. My special guest this episode is Kamilah Davis, who is the program coordinator for the Perinatal Equity Initiative at Santa Clara County. Please join me for a quick conversation with Kamilah. We are back, and I am here with Kamilah Davis, who is the program coordinator for the county's Perinatal Equity Initiative. Thank you so much for coming to talk to me.
Thanks for having me.
Let's start out with some definitions in your title. Perinatal Equity Initiative. What is that?
Totally, it's a mouthful. So the Perinatal Equity Initiative is a state program, and it was conceived, no pun intended, to complement the work of the Black Infant Health Program. So the term perinatal just describes that period in a person's life where they are pregnant and directly after that. And perinatal equity really means that each pregnant person is able to achieve their fullest health potential and get the best outcomes possible for their pregnancy.
So we know and have known for decades by research and by intuition much longer that outcomes for Black mamas and babies have had higher rates of mortality and morbidity, which are both horrible words. So let's talk about what those mean, and then kind of why there is this racial disparity that doesn't necessarily apply to all people of color.
Absolutely. So mortality refers to death. So Maternal mortality and infant mortality are two measures that we look at, and that describes the death of a person associated with their pregnancy, either during their pregnancy or directly after. And then infant mortality is the death of a baby before their first year of age. And exactly as you said, historically, since we arrived in this country and were trafficked into this country through the transatlantic slave trade, we have had much more disparate outcomes compared to other racial groups. As relates to death of pregnant people and pregnant babies, and that's really due to structural racism. And there is a already large but growing body of research that pinpoints that, as you said.
Can you talk a little bit more about the structural racism impact directly on health outcomes? We know this isn't a congenital or medical difference.
Absolutely, and I think that honestly gives me hope many of the time because it is preventable. So the CDC said that across the country, 80% of maternal deaths are preventable, and so the solutions really are things like implicit bias training, supporting Black women while they are birthing and afterwards, like some of our programs do here at Santa Clara County. It is 100% fixable, and and we're doing a lot here to really try to do that.
I love the suggestions that you talk about in terms of how to fix this, because the approach really is as a social norm as opposed to a pathological one. How do we talk to the medical community about this, the doctors and nurses who want things to be correlated with some kind of physical condition? What should they be doing differently?
Totally. I would say because there's such a large body of research, really, and I know that that's something that, right, in the medical field, it's like a lot of the evidence-based practice is focused on evidence. I think that one thing would just really to be lean into the research. There's a lot of really great interventions that people have been positing, especially, so I mentioned implicit bias training, but also welcoming doulas and midwives to your institutions. Making referrals for patients to culturally congruent supports in the community. So those are a couple things, but yeah, I would say there's a lot of good research about it, and to just really lean into that as opposed to the way that folks have been learning previously, and a lot of those practices are rooted in racism. And so by structural racism, we're really talking about not only the experiences that pregnant people have, like in the hospital, but also kind of how our structure has evolved over the last 300 years to decenter women, ironically, but not ironically, because women are the ones having babies.
Right.
Yeah, and to,
Well, so much of the birthing process, I think, seems to not center women and their babies, whether it's issues of not being listened to, symptoms being disregarded, somehow being told that we can't really know what we're talking about because we're not professionals. And I know that one of the myths that's still prevalent is somehow that education level and income level are related to the health of a pregnancy and the health of an infant, but that is not correlating for Black women.
Absolutely, that's true. So yeah, things like education and income, which are normally very protective when it comes to health outcomes, in the case of Black women having babies or Black people having babies, it is not protective. And in fact, we see those same gaps in infant mortality, severe maternal mortality, and morbidity, as we see, people who are very wealthy and very educated also experience those same disparate outcomes.
And there's some really kind of famous stories of women celebrities who really have faced those same challenges, really of not being listened to.
Exactly.
I know that some of the great work of your department involves putting on a symposium or a conference each year. They're upcoming now. I know by the time this podcast is shown, they'll be past. But can you tell me what you're excited about and what's coming up this week?
Definitely. So we're definitely excited to partner on the screening of the 2 films by Black women, and it'll be here on Thursday, or for you last Thursday. And we're also hosting our 2nd annual Perinatal Equity Conference, and that will be on Friday. And we are going to be recording, so we'll maybe give you the information to share with your audience
Oh,
about where they can
perfect.
access the recording of some of our keynotes.
Perfect. Thank you so much
Thank
for
you.
talking to me. Thank you for continuing to teach me about this work. It's been an exciting learning journey and policy journey for me, and I'm particularly proud right now about the partnership that we have with the 9 Bay Area hospitals,
Yeah.
who have all committed to really looking at their data and looking for ways to better support Black pregnant and birthing people so that we can turn this around. And it makes me so excited to think that really in a reasonable amount of time we can shift this and we can show trends that have changed. So I love that you're at the forefront of that. I will continue to be here to be supportive and encouraging and lead from the policy perspective. And we'll come back and talk about it again when we say we have fixed everything.
We can and we will, yes. Thank you.
Thank you so much for joining us. Take care.
Thank you.
And just one more thing. For today, I will share what my team thinks is pretty fascinating news, and that is that I am left-handed. Since I have always been left-handed, it has never seemed like a particularly notable thing to me, but I do know that we are a minority of the population. I know that there are lots of famous smart folks who are left-handed, including Presidents Bill Clinton and Barack Obama. And I will tell you for sure that some things are a little bit trickier. You gotta use a scissors or a spatula or a ladle. Those are all largely designed for right-handed people, so that's a little bit complicated, but we learn to cope. We left-handers are very resourceful and very thoughtful. And I'm totally not an athlete, but when I do try to play sports, I actually do them with my left hand. I would hold a golf club and a tennis racket in my left hand, and I think a bat in my left hand, although I don't think the bat would ever actually leave my shoulder because I would be scared to swing it. But anywho, my fun fact for today is that I am left-handed. If you are too, let us know. Have a fantastic day.